I'm Dr. Jen with White Wave Bodywork, and I'm here today to talk with you about stretching the fronts of the thighs. So what I want to try to do is start in standing for this particular stretch and have you somewhere where you can reach a wall with one hand. So we're just going to try to balance on one foot and see if you feel steady enough to do this. If that's fine for you, keep moving forward. If not, I have plenty of laying down options for you to stretch the front of the thigh. So scroll back and look for different videos if this one doesn't feel comfortable for you. So in standing, I like to pull the knee up and forward first because it's easier to reach the foot here and there's less cramping that happens. A lot of times when I ask people to pull their heel towards their backside, their hamstring starts to cramp. So if you can pull your knee up forward, then that's usually a more comfortable way and easier way to grab the foot in this position. From here, we're going to try to pull the knee down towards the floor. Now, in that motion, there's a lot of different components. So when you're pulling the knee down towards the floor, a lot of times what I'll see is that people really sway their back in order to get there. So the first thing I want you to think about when trying to do that is, can you keep the pelvis tucked posteriorly? Another video we talk about pelvic tilting. So in this one, since this motion creates an anterior pelvic tilt, in order to create balance, we're going to try to do a posterior pelvic tilt. And if you notice, when I escape here with my low back into that anterior pelvic tilt, it's way easier for me to get my knee back, right? So when I tuck and bring this pelvis back, that is connected to the front of my thigh via these hip flexors. So what I want to do is try to create that tuck of the pelvis, posterior pelvic tilt, and pull back. So one of the ways that you can do that is by squeezing your butt cheeks. If you don't feel like you can feel it or know how to do it, then try squeezing your butt cheeks and then trying to pull back against it. There's this fight between the pelvis and the front of the thigh that you've got to kind of feel for yourself to understand it. The other thing that happens is when I ask people to grab the foot and pull it back, do you see how my knee wants to pull out to my side? So that is super, super common. What I want you to try to do as you're in this position, do that butt squeeze, try to get your pelvis to tilt back, try to pull the knee back towards the hip, being underneath the hip. So pulling it back this way, and invite the knee to come down toward the floor or toward your other knee. So pelvic tilt, posterior pelvic tilt, try to pull the knee back and try to pull it in towards the other knee. Now the only other thing here that I like to bring attention to, well, two things. The shoulder position. So when I pull back, you see how my shoulder can be pulled down and forward here? What I want you to try to do is lengthen the side of your body by drawing the shoulder up towards the ear, back towards the back of your body, and bend your elbow so that it's pointed straight back. Then do that pelvic tilt, move the knee back, invite the knee towards the other one, and look at your rib cage. This is the other one, so shoulder position and rib cage position. So from here, can I keep the pelvic tilt, keep the knee back, and try to bring my front ribs back? Because it's usually a compensation to bring those front ribs forward. So we're gonna tuck the pelvis, move the knee back, hug it in towards the midline, make sure our shoulder mechanics are good by drawing the shoulder up and back, elbow back, and then front of the rib cage back. In a different position so you can kind of see it again. I'm knocking over things here. Knee pulls forward, grab the foot, pull it back, and the alignment that I'm thinking in my head is, can I posteriorly tuck my pelvis, pull the knee back in line with my hip, invite that knee toward the other knee by hugging the midline there, shoulder up and back, elbow back, and front of the ribs back. Ribs cage back. That activates those upper abdominal muscles and aligns the spine a little bit better in this position. So that's a standing quad stretch. There's a lot to that standing quad stretch. In order to get all the different components done, you're going to want to hold that position for what some people say like 30 seconds. Other people talk about 3 to 5 deep breaths, but long enough for you to work through all those different components. And that's what I think is important in a lot of stretching, is holding it long enough where you feel like you can check in with your body and see, are my hips where they should be, my knee, my ankle, am I grabbing things well? Think through it. Create that awareness through what you're doing and really focus on it and see if you can do it with those good mechanics. And that'll help you hold it there long enough that you feel like you're actually gaining some stretch. All right, I hope you learned something. Thanks for watching. Have a great day.